Last year was a record year according to the Irish Nurses and Midwives organisations right across the state. 122,000 patients in hospital trolleys, and people in the audience have rightly described many emergency departments as a war zone. So we know what the problems are, and the problems have been around for some time, but the solutions have been around for a long time as well. We know, according to the ESRI, we need at least 1,000 additional hospital beds. That was a report that was published last year. The Minister for Health, a number of times last year, promised that in 2024, this year and next year, 1,500 rapid build beds would be delivered. The funding has not been made available in the budget. In University Hospital Limerick, it's accepted by the HSE and hospital management that there is a shortfall of 220 beds at a minimum. But what the region needs right now is the 230 beds in Limerick that were promised, and as I said, 1,500 beds were meant to be delivered over the next 2 years. The funding isn't there. But if we don't get all of the issues right, and I have been in University Hospital Limerick, I've met staff, I met management, I met people who work on the front line, and they tell me that they need beds, but they also say that there's real pressures in terms of out-of-hours GP care, people with chronic pain who can't be managed in the community or at home, older people who can't be managed in the community. If those teams are not in place and are not providing that care, the only option is for people to go to emergency departments. So you have to get all of those areas right.
Okay, let me
if you really want to address the problem.